when you talk about those comorbidities of structural racism, disparate health outcomes, unequal access to healthcare, it really is a painfully perfect storm of hurt. And so again, we did know early on, anecdotally, we saw that with H1N1, and we've seen that with everything, as the old adage goes, when everyone else gets a cold, Black folks get pneumonia. So that is as literal as it is metaphorical. So, we could predict how this would play out. And that's why within weeks of the pandemic, myself and Senator Warren introduced legislation, the Equitable Data Collection Act, because we believe that which gets measured gets done. And the initial data collection was just age and gender. It did not include racial demographic data, and we wanted that data. And so, of course, once we had that data being collected, disaggregated, and reported in real time, it confirmed our worst assumptions. And then we were able to use that data to prioritize the coordination and the marshaling of resources in those marginalized communities, African Americans and people of color and immigrant communities. And so in keeping up with that, more recently, I've been advocating for the collection of anonymized demographic racial data around vaccine recipients. Because again, that which gets measured gets done. And so as I said in my opener, we've already seen this sort of vaccine redlining, if you will. And this is another reason why we've been asking for the data. We submitted a letter to the Department of Health and Human Services, myself, Senator Warren, and Senator Murphy around that. But, you use the word confidence a number of times, in your opener there. And so I want to pick up on that. Dr. Gibbins, getting a vaccine is an important personal health decision. And as a medical professional, but also as a Black man, what helped you make the decision to get vaccinated?
Well, just to be accurate and full disclosure, I have not yet gotten vaccinated.
Okay.
In part because I do not rank with the highest risk groups at the current time in the locale where I am. And it was my feeling that I should wait my turn, that those who need the vaccine most should get it first. And as you're aware, there are policy guidelines that relate to those on the front lines, particularly healthcare workers, those involved in the essential service work that we described earlier, that have borne the greatest brunt and risk related to the pandemic should get it first. And then it'll proceed down in priority order. And so we anticipated.
So when it is your turn, will you get the vaccine?
Absolutely.
Okay. And so what's informing that decision? And I'm telling you, some people might say, why am I even asking you this question? Because you've already queued us up with, that you believe in science, right? You believe in the efficacy of the vaccine, which you'll speak more to in a moment. But I actually have been confronted with many healthcare workers who have that fear and that skepticism about getting it. And they're in the prioritized group and they're waiting. So I make no presumptions here because you are a believer in science. So could you just speak a little bit to that? When it is your turn, will you get the vaccine and why?
Yeah, no, it's a great point. And as you're pointing out, clearly a very data-guided leader, that's what the studies are bearing out to date, that there has been that sense of what's called vaccine hesitancy, in which a number of Americans are reluctant to, even if asked, if a safe and effective virus was available today, would you get it? The proportions have been relatively low. And what we're encouraged by, however, is that the curves of recent polling and surveys is on an upward trend. I think one of the concerns that the NIH and SEAL had, this Community Engaged Alliance Against COVID-19 Disparities, was that there was a lot of misinformation out there related to the vaccine. There were thoughts about, things that could happen and have adverse effects that, quite frankly, were inaccurate. And so an important aspect of our efforts have been providing authentic, authoritative information that's science-based. And most importantly, I think a critical part is that we've collaborated with trusted messengers who have roots and representation of the communities of color that are most adversely affected. And we found that those trusted messengers, given trustworthy information and conveying to communities of color, I think have contributed to a rise in that sense of confidence that indeed this is a process that despite misinformation to the contrary, was not rushed, and that it was expedited based on technology advances that have happened over the last decade. As you pointed out, this isn't the first time that the enterprise has been faced with a novel coronavirus. It happened around 2001, happened again 2011. So this latest version, we've learned from previous ones, and technology has enabled scientists to develop a vaccine and develop it in record time. It then has gone through all the rigorous checks and balances of any therapeutic agent to ensure that it's safe and effective. We were monitoring all those trials as they've played out over the last year, involved the NIH, indeed, with the NIH director, Tony Fauci, and others. We've been surveying all those trials all along to ensure that, number one, for this audience, that they're inclusive, that indeed that the participants reflected America. And I might say that if left spontaneously, that the hope that those trials would be inclusive, they would not have been.
That's
That
right.
took a lot of leaning in, efforts like yours to really make the case, demand what you were doing publicly, we were doing privately, in working with all the study trials, some of which we fund, to ensure that the participants in these trials included Black and brown folks. And for the most part, most of the vaccine trials hovered around 20-25% of Latino and African American. And so that was successful. I think that's critical to the confidence, because if I was your doctor, Congresswoman Pressley, and I write you a prescription, any prescription, I want to be able to look you in the eye and say, I know this will be effective in you because it was tested in individuals who are just like you. And it was shown to be safe and effective. I believe we can say that related to the vaccine trials. Similarly, you should be aware that those trials were done and assessed by independent review boards, data safety monitoring boards, whose job it is to look solely at safety as well as efficacy. And I may also say that that's part of the job of the Food and Drug Administration to oversee that, as your audience know, and I know you know. And it should be noted that there was representation on those advisory boards. A good colleague friend of mine, Dr. Hildreth, is a member of that advisory panel. They're the ones who make the independent judgment. They're nonpartisan, non-political. They go with the science, and they confirmed, and he confirmed as an African-American clinician scientist, that the data was compelling, safe, and effective, and inclusive of communities of color. That's what gives me confidence. That's what gives me joy that actually my sister, who lives in Boston and who is at risk, has been vaccinated. And that's what I would encourage all of us to do. The data is now quite clear. There have been tens of millions of Americans now vaccinated. And again, it is validated that this is safe and effective.
Thank you, Doctor, for speaking to the efficacy and how it was developed, and just speaking to the power of representation, that when we have people in these positions such as yourself, and that they are sounding, the alarm, if you will, about, what will happen if we do not do this, it has an impact, it makes a difference. And so because you made sure that there was a diverse representation in those trials. And then also we're speaking early on about the need for there to be an investment in education and awareness, and that we invest in and partner with those trusted community voices. So it is not or, it's and. It is not just about access It is also about cultural competency and language access and information justice. It is also about trusted messengers. Um, and so to that end, I would just say that from the beginning, I've been fighting for, once a vaccine was developed and made available, that it be equitably distributed and that we prioritize incarcerated men and women, because in the same way that we are prioritizing nursing homes, because these are congregate facilities where it is very, very challenging to socially distance. They are ostensibly petri dishes for a virus like this to thrive. And sadly, we have seen that happen behind the wall. So I was pushing, early on for those behind the wall in nursing homes and our elderly and our essential workers. And that includes everyone from custodians in hospitals to healthcare workers to grocery store clerks to postal workers and letter carriers, to our educators. Mm-hmm. Now, one group that I had not considered in that, and so I'll be fully transparent as a Black woman who does have 2 pre-existing conditions, was myself. I certainly had not considered myself a priority in this. What happened for members is that we were confronted about the need for continuity of government, that we were all going to have to come together to keep the government going, not remotely, but in person. Of course, this was days before the insurrection, in order to elect a new Speaker of the House and to vote on the rules package, which meant that 436 of us would be in the House chamber at a minimum to do the business of the people. And of course, we've seen 10% of members who have tested positive. We are high risk because we travel, we're on airplanes frequently. And then in order for us to do our work, although we've tried as much as possible to operate in a way that is hybrid or entirely remote, that there is a greater risk. And so I would advise everyone to, one, make sure you're getting the most accurate information, because Dr. Gibbins, you're right to point out the misinformation that has been, circulating online. So talk to those trusted advisors. And for me, that begins with the medical professionals in your life. And so I had a conversation with my primary care physician. And again, because I do have 2 pre-existing conditions, and because of the nature of the work that I do, I made the decision that I would get the vaccine. So I was struggling with a lot in terms of whether or not I was worthy of getting it. But also I did admittedly have my own fear and skepticism because of a history of medical apartheid and the violation of trust by the medical community, onto the Black community. And so I'm not exempt from that, even though I work hard to combat it for others. So I had to, get over that myself. But when I had the opportunity to be vaccinated and with the advice and counsel of my primary doctor and the house attending physician, a conversation with my family, I decided the best thing for me to do to protect myself, my family, and all those that I am in proximity to, and my community was to get vaccinated. So, that's my own situation. Now, Dr. Gibbins, as the director of the National Heart, Lung, and Blood Institute, you're well acquainted with the health disparities that Black and Brown communities have faced long before COVID, including in the Massachusetts 7th Congressional District, which I represent. We see very stark disparities. They've certainly been exacerbated in the last 4 years, compounded by the last year in particular, but they've existed for a long time. In a 3-mile radius in my district from Cambridge to Roxbury, life expectancy drops by 30 years. So unfortunately, it's really no surprise that this pandemic has disproportionately impacted communities of color. So Dr. Gibbons, you spoke about a little bit to this in some of your previous comments, but could you speak more pointedly to the comorbidities and underlying health disparities that have exacerbated the COVID-19 crisis in communities of color?
Yeah, no, you make several great points there. As you indicated, this concept that you described quite eloquently about redlining is that we actually have funded research that has been able to track individuals over time, decades, in our longitudinal, what called cohort studies, like the Jackson Heart Study is the largest cardiovascular epidemiologic study in the country. It's actually in Jackson, Mississippi, all African Americans. In the Boston area, Framingham Heart Study, many people are familiar with, since 1948, has helped us understand the trajectory of cardiovascular disease. One of the elements that may surprise your audience is that there was a study that showed that those who lived in racially segregated neighborhoods during their childhood and adolescence and young adulthood, if they remained in a racially segregated neighborhood, they were more likely to have a higher blood pressure than those who started in a racially segregated neighborhood, but then moved to an integrated neighborhood
Wow.
afterward. And so there are things that are the antecedents of heart disease and strokes that people think of in elderly or middle-aged adults. It starts very early, and it relates to the exposures and your access to a healthy lifestyle. And so we know that if you eat a diet rich in fresh fruits and vegetables, literally your blood pressure will be lower. We actually did a study called the DASH diet that demonstrate that. You're very well aware that access to fresh fruits and vegetables is not the same in every neighborhood. Just as an anecdote, I used to live in Rochester, Dorchester area. This many years ago when I was a medical student, and I still remember that I would always shop at the supermarket near the medical school before I went home to Rochester, to Roxbury, Dorchester area, because they didn't have supermarkets with as much produce access and variety in those neighborhoods. Now, hopefully things have changed over the last 20 years, but those are the realities, and those relate to historical structural differences in these neighborhoods that if you then compound to that diminished access to healthcare and other quality elements of life that promote a long and healthy life, you see the causes of these health inequities begin earlier and have these social determinants and structural factors that also drive them. This is important not only in understanding things beyond COVID, but even when we look at the response to COVID, we have to be really mindful that when we think about vaccines or access to any benefit, that we should be sure that we don't get caught up in those same structural barriers that have hindered very good health up until COVID-19. So that's really where there may be an opportunity, and we'd love your support to say, what can we learn from this pandemic and our response to it that will really address the underlying health inequities and build the resilience of those communities such that the next time there's a public health threat like this, that we're able to ensure that they're not the most adversely affected, as you
That's right.
indicated.